How will you check pain on your patients?
1 to 10.
Scale 1 to 10, right? So you're going to tell the patient what?
Hello,
In a scale
Mr.
1 to
Mrs.
10.
Smith.
What is your pain
Are
today?
you feeling any pain today? Yes. What is the scale from 1 to 10? 1 is the minimum pain, 10 is the maximum pain. I don't know how to say it in the professional way, but
Right.
I will learn.
Something that makes sense. So I think it says, okay, remember, you're not going to tell them if they have pain. The patient has to tell you. Oh, listen, my back hurts. Okay, so Mr. Smith, in scale 1 to 10, how would you rate your pain? 1 to 10. Being 1, very minimal pain, and 10, very hard pain, very excruciating pain. So then they said, oh, like 8. Oh no, that's more than 10. So you know already, right? That's it. Simple. Oh, respirations. No, we haven't done respirations. Okay, so when we do respirations, the first thing that you have to do is should not tell the patient that you're going to be checking respirations. Is that understood? Because usually we tell the patient, okay, I'm going to check your blood pressure. I'm going to check your pulse. I'm going to check your temperature. I'm going to check your weight. I'm going to check your height. And you tell the patient about the scale about pain. For respirations, we don't do it. Why?
They all start breathing funny.
Because then, exactly, they start breathing irregularly. Let me tell you what I did to one of these smart nurses. I'm gonna check your respirations, okay? And I said, okay. And she started like putting the hand right here, because you have to put your hand on the patient's chest, because you're gonna feel when the patient rises, and you count that. So, what is the rate of a normal respiratory? What is the respiratory rate? The normal respiratory rate? Anybody knows? Because remember, you took this.
30 to 60.
You will be dead.
12 to 20.
12 to 20 respirations per minute. That will be normal adults. This is the respiration rate. 12, and that's a questions for your exam. Oh my God, we're giving you all the questions. If you don't pass the test, listen, I'm gonna go to your home because I know your address, and I'm gonna wireless you. So you will see. So, respiration rate. What is the normal adult respiration rate?
12 to 20.
What is the normal pulse rate?
60 to 100.
I thought you were going to say 12 to 20, 12 to 10, because people sometimes get used to, right? Okay, that's how it works. And if you keep on repeating this, you're not going to forget it. And this is what you're going to be using in your workplace. Okay, so respiration rate. How are you going to do respiration? All of these things except for blood pressure, you're going to measure in temperature, you're going to measure pulse. Respiration rate, 1 minute, 60 seconds. So this is what you're going to do. Remember, your patient is going to be sitting down, straight up. Not like this, not laying down, no. It depends, but in your office, your patient to come over there has to be sitting. With the hand a little bit, the hands on the side, whatever you do, because you're going to put the hands right here. You put your hand on the patient's chest. And you start counting when the patient breathes in, because the chest rises and then falls. Don't count both, because you're gonna get lost. So you put your hand right there, and then don't look at the patient like this, because you're gonna make it. No, yeah, because you have the patient right there, and you're like putting like this in there. See, right there, your respiration rate already changes. It feels uncountable. No, really, because if you see all those things, you have to learn it, because if you don't know, you're gonna go over there, and the first thing that you do is,
Yeah, please.
right or wrong? See my classes? See? See how many times you laugh when you were in the other classes? All the time. With me, you're trying to be a little like not showing who you are, but I'm trying to get you there, right? Classes needs to be fun. Classes are not supposed to be bored, because then you're not gonna learn. You're not gonna be kind of interested. So if I tell you all this, is because exactly is what we do, not intentionally. You're coming out from the school. If I don't tell you how to do it, you're immediately going to tell the patient, okay, I'm going to check your respiration because you're so happy, and you go everything by the book. Everything that we learn, we think that we have to apply. No, there are certain things that do not go. So calm down, relax. I said, okay, I'm going to check your pulse. And then one more thing. You ask the patient to put the hand like her right there. You're not going to put your hand yourself on the patient's chest. Look at this. The female has a breast, and I put my hand over there. That's called sexual harassment. Right there. Even though if it is not intentional, it shouldn't be done that way. So my patient, I'm going to say to my patient, I'm going to ask my patient, please, can you cross your hand through your chest like this, and you show them, put your hand like this, and then you put your hand like this. And press. So I will go right here, and not looking at her, I just checking how many times my patient. See how many times my patient's chest is raising and falling. Now you can do it again for 30 seconds, right? And then you multiply by 2. Sometimes you tell them that you're checking the pulse. You pretend like you're checking the pulse, like this. See? And go like this. Oh, the patient doesn't know. You put my hand right here. The only thing is that you push the hand a little bit down, deeper. Because sometimes they just put the hand right there and you don't feel anything. No, you have to push a little bit, and then as soon as they do like this, you count 1, 2, 3, and so on and so forth. And you have your watch or your clock right there on the wall. We always have like that, and then I'm looking over there, and that's why I distract myself, not looking at her, looking at that.
So we don't use the little.
No, that's not for that. That's to listen the heart sounds.
Oh, okay.
Not for that. You don't use that at all. So you use that when we're gonna do blood pressure.
Oh, okay.
Okay, but you're not gonna listen to the heart sounds right here or the lung sounds. You're gonna press it right here. I'm gonna show you all that. That's gonna take a little more time, and that's when we're gonna spend more time doing it, because that takes a little time to listen to the heart sounds. And we're gonna do it 2 methods that we have: manual, which is by palpation, and the complete one. So one with the blood pressure cuff, the other one with the stethoscope without the pressure cuff, because it's a lot easier if you learn that way. You will understand when we start doing it. For now, you're gonna say, well, what do you mean you're gonna understand when you do it? You did it already, so you're just reinforcing that information, right?
Did what?
Whatever.
Because I don't remember us doing nothing.
So that's basically, have any of you done blood pressure before? Or you know how to do it? Excellent. You? Because you seem like you know a lot.
No, I just be watching videos.
That's good,
I
because
just
you
changed
learn.
my whole field for work. I changed my whole field.
Well, as long as you chose one for the right one, it's fine. But sometimes, certain things just don't work for us. And sometimes we get comfortable because we're just receiving money, right? But you're not happy in your job. If you're
That's
not
me.
happy,
Hated it there.
That's why I'm always tired and drained.
this is like when you're dating someone just for the heck of not being alone. That is horrible.
Yeah.
So, don't do it. Yes? Oh, I thought you said I do it. Because whenever I said something, you kind of go against what I said. I'm just speaking on you, okay? Okay, so that's basically what it is. Now remember, you don't tell, and those are questions for exam. You don't tell the patient when you're gonna be checking respirations, because the patient is gonna change the way that he breathes. Is that understood? If I tell you I'm gonna check respirations, and then
I'm gonna try.
I put my hand there. No, they get a little nervous and they go too fast, then little, and then you're not getting the right thing. So it's not good. But if they are not aware of it, then they will allow you to do it. So once again, just the patient, oh, let me check your pulse, and then can you please cross your hand, put your hand across your arm across your chest, and then just like this, you show them like this, and then you put your hand right there, and you pretend that you're counting the pulse, but you're checking the clock. So, okay. That's it. That's respirations. But we actually gonna practice it. I'm just giving you like a little heads up how it's gonna be, but we need to practice, okay? Because if you don't practice, it's like nothing, like watching a video. Nothing. You're not gonna stick with you. You need to learn how to do it. I was telling you that I went to the annual checkup, and usually every year I change doctor. I don't go to the same one. I don't have medical conditions, so every year I go to a different one. Because I used to go to my colleagues, friend of mine, and as soon as, oh no, you don't need to do anything. So they just talk to me and says, you don't have anything, right? No. Okay, they just fill paper. I said, no, you never know what's going on inside.
Yeah.
So do blood, check my lung. But because a friend of mine, you know what, they take it easy. So no, I don't need to do it. If you're not complaining about anything, next time. I said no. So usually I change medical doctors, and now I don't go to people that I know. So I went to this doctor for the first time. The nurse, because this was a nurse who was taking care of me, she was talking too much, just like me, but she was not a teacher. So, no, right? So she went like, okay, I'm gonna check your vitals. I said, sure. She didn't know who I was.
Okay.
Because I never said, oh, I'm a doctor. No, I just Alberto Hoyer, that's it. So she was like, doing stuff, and then said, I'm gonna check your respiration. She told me, I'm gonna check your respiration. I'm gonna check your pulse. Checking my pulse, then respiration. Then when she started putting the hand right there, I hold my breath for the whole time. Oh, she wrote something down. I know it was false. I didn't breathe. So I said, how's my respiration? Oh, it's normal. It's 18.
Oh no.
I said, how do you get it? Because I didn't breathe. When you told me that you were going to check my pulse, I hold my breath. She looked at me and she said, like,
And all of this, I think I'm gonna start doing that when I go to the doctor too.
that's how you know if they doing it right or not. So she documented right there on my medical record that it was 18. I was like, how do you get that number? Oh, we learned this and blah, just I counting how many times you breathe. I said, no, I do understand that. But how do you get this number? I wasn't breathing. I hold my breath the whole time. I did it on purpose. Just to make sure that I was not playing, right? She said, oh, are you a doctor? I'm an attorney, and a very good one.
She did it again.
She immediately became pale, and she was scared. Oh, wow, let me do it again. I said, it's not going to work because now I know.
The first time,
Yeah.
so you don't have those problems.
And that was not the end. She went to do my blood pressure, right? It was winter time. I did it on purpose. I left my sweater on top. She asked me to remove. I said, oh, should I remove my sweater? She said, no.
They do that a lot. That's not the only.
No,
They do
and
that a lot.
that is wrong. Your arm should be there just like here. You should not check blood pressure on top of clothes. The clothes jeopardizes the heart sounds.
Okay.
How are you gonna hear them? Or if you hear them, you're gonna miss the last ones. So the diastolic is gonna be wrong. Because remember, blood pressure, we have two numbers. Systolic, diastolic. The one that is caused by contraction, remember when the heart contracts, the ventricles ejects the blood, then the systolic appears on top. And then the other one is when the heart fades completely, you don't hear the heartbeat anymore. That is the diastolic. So immediately, she did it like that on the clothes, and I said, "What's my blood pressure?" Ah, one more thing. They're not supposed to be telling you, "Is this, because that's diagnosing me." It sounds silly, right? Because 99.9% medical assistants, technicians, nurses that are not supposed to be diagnosing always tell you. They tell you all the time.
So what if after they do it, they be like, "Oh, it's good, it's good."
No, not it's good. What is good?
That's what they be saying.
Exactly.
They do.
They don't give you a number, but say, no, it's not. Oh, it's normal.
Mhm.
Oh, it's normal. You should not be telling anything. You know what? How is my blood pressure? Doctor is gonna talk to you about that. Oh, but I don't care who told you before. Of course, you're not gonna tell them that. That's
You see,
the doctors.
we so used to them saying that. I feel like if they say that to me, I'll be like, "Oh God, I'm dying." The doctor got to talk to me.
No,
Like,
no,
for real,
it's
'cause they
just
always
that-
be like, "Oh, your blood pressure's good."
See, that is the reason why we get used to
Yeah.
the wrong things. So when somebody tells us the right thing, then we get scared. How many times medical assistants, nurses have told the patient something, and it turns out that it wasn't like that? It is a lawsuit.
You know, a medical assistant, I was supposed to get the flu shot, and she came to talk to me about a second trimester thing. Like if I was pregnant, she was telling me another patient.
Oh my God.
And I was looking at her like, I'm not pregnant no more. She had me scared. Like,
See?
if,
You was
See?
pregnant.
See,
what?
that is
And
that
then
is
she
going
said second trimester.
that-
I'm like,
that is
whoa.
going beyond your scope of duty.
Mhm.
Even though if you ask me about any of those, I would say you need to talk to the doctor.
Yeah,
Okay?
she
Thank
was
you.
basically supposed to do like a, you know when they give you like a they give you like information about
Mhm,
your
mhm,
trimester and
mhm.
stuff. She was supposed to do that, but she didn't ask me what my name was. She just came in the
Jesus
room and
Christ.
just started.
Right.
And
Just
I was
because you're a
looking at her
female,
like-
so she assumed, okay.
Yeah, and I'm like, I'm
To me.
supposed to just get a flu shot.
What happened before to me was when I went to change my
Patch.
my next plan on,
Mm-hmm.
they had to do a sonogram, like in there, and she told me everything is normal, but don't tell the doctor I told you.
Oh, so she
I
knew she was doing something.
think that is
Don't
normal.
do that.
She was trying to, protect herself. Oh, I told her, but I told her that I'm not sure. That's what it was telling. You should not open your mouth at all.
See, and if I would have been another person,
Exactly.
I would have told the doctor, "Oh, she told me."
Right, and most of the people do.
Mhm, they do.
That's how you get in trouble, because the patients. Remember, I was working in a hospital and clinics, many places, and I have the patients coming up to tell me, "Oh, the nurse in front," because I always think that everybody who's in the front is a nurse. Oh, the nurse in the front, she told me, or he told me this. Then we have to explain. You know that we get paid by the minutes. We get paid by minutes, not hours. Because, exactly. If the insurance pay us per minute. So if we have a patient who doesn't have issues, they just come for a routine checkup, we're supposed to be spending 15 minutes with them. We cannot bill for longer than that. But now, I have to explain things and it's going to go beyond those 15 minutes. So now I have to bill for more, but the insurance is not going to pay for it. Because the insurance is going to say, no, that was a regular routine checkup. We're not going to pay you for that. And now I have to explain all the things that you messed up. Because you went and told her something that is not like that. Now I have to fix things up. And then I go to you and I fix you up, fighting you. Yeah, that's how you get. So be careful. This is all you have to do. Protect yourself. It is so
but-
easy to fall into trouble.
But we're gonna get in trouble that fast because we're new and we're not gonna be perfect.
No, you will not get in trouble because, first of all, you're coming right here from school. I explain you. Don't say anything. Don't tell the patient anything. Don't care if the patient like you or
No.
don't like you.
Those things, yeah, we know, we understand. But for example, like if it happens to me, what happened with her, with the patient when I'm drawing the blood, you see how her
You're not
blood
gonna
came
get
out?
fired for that.
No.
No.
Okay.
That's why you're gonna take advantage of your internship, right? Because in your internship, it's like your first experience with real patients.
And we won't get in trouble with internship either, right? Like they won't.
You get no. If you don't do, you miss the blood or the needle came out. No, you're not gonna get it. It's just don't panic
Okay.
and
But even
learn
the ones,
from those
even
mistakes.
the ones who are already working, because especially like for somebody like
Right.
me, I had 4 people stick me.
Yes.
But they
It doesn't
can't get
matter
in
how
trouble
many.
because it's not they.
Now, you're gonna make a decision when you find a patient that you don't see the veins. You gotta make a decision. You gotta be smart. Go there and says, okay, let me check your arms. First of all, you're gonna feel nervous because you have a patient like that. You're gonna feel nervous because you're in a place that you're working or you're doing your internship, right? So don't put yourself in trouble trying to find something that you feel uncomfortable doing.
Ask.
Ask someone else. Remember, during your internship, you're not supposed to be left alone.
Yep.
It's not like you're not an employee. They can tell you, okay, patient blah 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 is coming here, go draw blood. No, okay, remember I'm an intern, so somebody has to be with me. I'm gonna check. Tell them, this is what I tell them. I'm gonna shadow you, okay? Can you do this patient to see how you work? I know how to draw blood, but I draw blood between ourselves. Remember, this is the school. Now I wanna see how you address this patient, because I heard you're really good. You lie to them, make them feel good so they can kind of, interact with you. So I said, oh, I want to see how you do it, because you've been working here longer, so I need to see how you actually do it. And then the next patient you help me out with. And then if you see that they don't have good veins, if they try to embarrass you, no worries, step away from there. Do something else. There is always going to be someone who want to play tricks on you. They don't like you. They think that you're going to replace them. They are scared. There is always something. They always blame the new the interns as if you're going to be taking their job. They don't want to teach you. You got to be smart. Remember what I
They're gonna
say?
hate me because I be
Tell
asking
them.
questions. How you do this again? How you do this again? How you do this again? If I don't know, I'm gonna ask.
Yeah, but you need to know how to ask. You don't go like that.
No,
How
I
you
mean,
do this again?
no, I'm obviously not. But like in my job, my she's my supervisor now.
I
The
thought you said my
coordinator-
supervisor.
the coordinator supervisor, she would get annoyed because I would ask her
Yes.
questions, and I used to be like, I don't care if you got straight up.
Yeah.
I don't care if you got annoying. I'm gonna ask.
You told them?
I told her, but me and her, we cool.
Yeah. That's one of the things that we should not kind of pass that barrier, because the more that I'm close to you, the more serious I have to be. You know what I mean? Sometimes we're Latinos and we're like that because we grew up in that environment, right? But here in your workplace, people change. So if you know someone, that will be great for you, right? And probably they're gonna help you. And probably I'm gonna say, listen, I'm gonna say that teach me as much as you can. I'm trying to learn this. That would be nice. But someone who doesn't know you and they just turn the back on you, don't force them. Do something else. Try to do it in a different way. Remember, when you get to the place, be nice. Become an ass kisser. Do that. You know what's an ass kisser, right? Tell little things, nice things. Remember that I said that? Wow, how nice. Oh, look at
me
this.
too.
Huh?
I think
Well,
it's hard
you gotta
to
know,
do.
well, it's gonna be harder if you do not do. Remember, we're gonna become like actors. I'm gonna tell you what you wanna hear. And if I want you to be in my side, I'm gonna tell you things that you're gonna like. I'm not gonna go there with an attitude. Oh, I'm cuter than you, I'm younger than you, and I'm fresher than you, and my school is than you. No. You're gonna be very humble, or at least you're gonna pretend you're gonna be, and they're gonna say, oh, hi, how you doing? Good morning. Wow, beautiful bracelet. Where did you get that?
I'm not like that. All right. Good morning.
Yeah.
Well, then that's being rude. You're not gonna get anything from these people.
Because if I say good morning,
No.
if they give me an energy that I do not like, they not gonna hate me.
No. Listen,
I'm gonna just ask
there
them.
are some people, these ones, you're gonna get to know them as soon as you step in, but you're not gonna become one of them.
I mean, I met someone when I went for the interview. He did like a tour
Mhm.
and then he introduced. There was like 5 of them, but they was alright. I guess because he was staring at it. He was like, hi.
Right.
They introduced themselves. They
When
said their
you're gonna
names.
see the difference when you go there. They probably be nice, some of them. Not everybody's gonna be bad. There's gonna be someone that is gonna click with you. All depends on your personality, how you behave. So get this acting to play. Believe me, it works because it worked for me. I was the only male working in the middle of all these medical assistance fields. You think that because you're a male, probably they're gonna have like a little affinity, like you're doing. No, they were like, he's gonna show us what is it that he has. You know what I mean? Let's see if what is he here. And I was nice. I said, oh, good morning. How you guys doing? And then, wow, nice days. Wow, nice days. I'm not like that either. But I learned my lesson. Because when I was rude, I didn't get anything. So now I start to tell you, well, you're not gonna go overboard. In a minute, you're gonna describe 20 things that you have nice. No, today you came and says, wow, nice hair. I like your ponytail, kind of thing. That reminds me of my little sister. And then they feel like something good.
That's too much professional.
No, it's not. No, it's not. So find something.
I'll
How is
probably
it
be
that
like,
you're
oh
not
my
gonna
God, you
find?
look nice today. Oh, today, so every other day I look ugly.
See, that's taking it personal. Because first of all, this is the first time. And that's a different issue. You look nice today. Oh, you look so pretty today. So I'm being ugly all the time. Look, see, if you don't know the words that you choose to use, then
So
that's gonna
I
fire
said
back.
nice today. You look nice.
No, you don't say you look nice. Something on you look nice. Oh, I like your jeans. These are the most,
I like your hair.
These are the most cute jeans ever have seen.
Nice
I'm gonna tell you.
makeup.
Yes. That's how you say it. Nice haircut. Tell someone. You have to be, come on, who doesn't like to receive these type of compliments? Don't go overboard.
I got shy.
And don't go like you are kind of insinuating something. No, just be normal. Wow, I like the sweater. That's it.
Okay.
And then when you tell them, then you tell them, whenever you're gonna draw blood, can I stand right next to you so I can kind of see everything you do? And if they said, oh no, because this patient, okay, whenever you feel like, you can take me to a patient, I want to see how you do it. Because I heard you're really good drawing blood, and you're the horrible one. It doesn't matter, you're not telling them. It's not
Where you
understood.
heard that from?
Hmm?
Really? Who you heard that from? Who you heard that from?
Me. Listen, we are acting, right? So you're not being real. Now, if you're gonna be real, even better. Sometimes I try to bring up things that you really have. You know? But sometimes there are people that are so rude to you that you just don't find anything good to say. Well, pick up the clothes, the boots. I don't know. Don't tell them about makeup or anything that says, no, you're covering all these holes that you have in your face now. So say things that are not too much for them, that they're gonna believe it. How you gonna say, oh my God, you look beautiful, you saw the most ugliest one in this office, right?
For the most part, every job I had, I got along with everybody.
You do?
Yeah, like
How's that?
No,
How's that?
I got along with everybody. In my job, there was this one girl. We didn't really get along, but we got along now. We spoke about
See?
it, hashed it out.
See how things start falling apart? I got along with everybody, but now there
In
was
my
one.
job,
No, just
no,
kidding.
in my job, we got along.
Listen, we are
We
not
fight.
$100 bill that everybody wants to hold. You know, everybody wants a $100 bill. We are not. So some people they're gonna like it, but depends how we present ourselves from day one. They're gonna like you. They're gonna dislike you. That I can reassure you. Think about you in your job, and a new kid on the block comes in, and comes with an attitude. You notice it immediately. They think that they are better than you. Or because they just graduate from this name school, and then they think that, no, calm down, relax, be humble. Good morning. There is anything that I can help you with? Oh, I want to learn. Oh, what is this? Oh, what is the storage room? Where do you find the needles? Whenever you have a time, can you just walk me around and show me things? As favors. It's not at the last minute when you need something that you're not come to them. Don't sit somewhere. Don't go sit in a corner or try to hide in the bathroom and things like that, wasting time. Oh my God, I want the time to run because I don't want to be here. Listen, it's going to be 300 hours. So you're going to be there for a while.
And I feel like once you start doing it, you want to get yourself in a routine.
Oh, exactly.
If you don't, you're going to be messed up.
That's the point of going for an internship.
I used to work at one school. I did everything in that school. I don't care whatever y'all asked me to do. Go over there, go over there, go over there. I went to another school by myself
listen,
with nobody. I did everything by myself.
Listen, give me 5 right there because that's what I did. I never kind of hide myself, trying to cheat myself and say, no, because I'm wasting time. I'm not learning. They put me to do a lot of things that wasn't supposed to be my job. I was doing these people's job. I knew it. I'm not going to argue with them. I went and did it. But when I had my time and they knew who I was. Then your true colors start coming out. But now you fix. Now you're steady. Not at the beginning. Remember, you're going to be an intern. But when you start really working in a place, you're going to do exactly the same as the intern, with the difference that later on, when you put your feet and when you're secure, now you're not going to give me your crap. So, oh, listen, oh, you have something right here to do. I'm still working on whatever they gave me, my assignment. But whenever I finish, I help you. Don't say no 100%. Tell them that you're going to help them later on. Sometimes you're doing something and they said, oh, I need you now, leave that out. Something else more important, do it. Don't argue. Don't say, oh, but I haven't finished this, I have to finish. And then you guys never let me finish anything. Don't worry. Somebody's asking you to do something else. Go do it. Don't fight. When you are like this, sometimes people are proving if you can take stress. If you cannot manage that, you're out the window. So learn from me. I was never fired from a job. I was the one who quits. And I quit because I was not happy in that place. Not because of anything else. I was not happy. We get to the point in some places that enough is enough. Money is not everything in life. When you think that because I'm got money, I let people go over me and things like that, if I'm not happy, if I have to go home and scream my family and not being able to sleep well, not eating well because I'm thinking about all the troubles that I'm facing just because I'm making a couple of dollars more, no. Peace of mind is a lot better. See, I could be working right now in a university just the way that I did it before. Getting paid $85, $100 per hour, just teaching. I get here half of the money, but I don't care because here I'm happy. This boss of mine, he's awesome. He listens to me, and I listen to him. And he says, we're going to work this way. Dr. Hoy, you have more experience in your field. What do you think about this? The other ones, they didn't care. The other ones didn't care. They knew that things were not right, and they continue. Same thing, because they're just waiting for the paycheck. This is like family business, right? Family business, people care more because this is small business. And large business, who cares? There are many owners of the place, so they do whatever they want. And they hire and fire whatever they wish. So in our jobs, don't take things like lightly. Learn the real thing. So then you can apply for another job. You gain some experience. But if you get frustrated and you try to cheat time and things like that, hiding here, and you're not learning, what experience are you bringing to the other place? You're going to be lost, and they're going to tell you, oh, wow, but you were there working for this time, and you don't know how to do this, so now you are in a real bad position. So play around a little bit. Listen, we are bipolars by nature. Aren't we? When you are with your friends, you act one way. When you are in the school, you act the same way. Oh, I'm sorry. You act different way, right?
Yes.
In our job, we act a little different than we do with our family. Well, depends on the place where we are, who we're dealing with. We're going to be a little different. And that's professional development. The real thing, the real job. How you going to, because you don't know how people is going
to.
to.
Career stuff. You're giving it to us right here. The whole career.
Every single time, I'm giving you tips of how, to manage things at your workplace, because that's what's going to keep you in your job. And not only keep you in your job, that you're going to be comfortable in your job. I'm telling you, being bored, not liking your job, that's the worst thing that can happen. Think about hanging out with a boyfriend that you don't like, someone who treats you bad, but because it's paying your bills, you take all these insults and all this cheating and all. That's not good. We can do better than that, don't we? The same happens in our jobs. If you really learn the things, you can compete with anyone. This is not the only job. I can move to that stuff. I can move to that one. You apply because you feel confident that you can do it. But if you are mediocre, nothing, you didn't learn much, and you just trying to get by, well, that's the opportunities for you to get something better. And it's going to be very slim, right? All right, guys. So then I gave you a lot of lectures now. I feel bad.